The Royal College of Pediatrics and Child Health has issued a grave warning. They say wood-burning stoves are harming our children. These stoves release dangerous pollutants into the air. This is a serious threat to children's health. We must take action to protect our youngest generation. Parents are often unaware of the dangers lurking within their homes. Wood-burning stoves, while seemingly cozy and traditional, emit harmful pollutants that can have devastating consequences for children's developing lungs. The charming aroma of burning wood masks a sinister reality, the release of microscopic particles that can penetrate deep into the respiratory system. Wood smoke contains a deadly cocktail of toxins. These include particulate matter, nitrogen dioxide, and carbon monoxide. These harmful substances are released into the air every time we light up a wood-burning stove, creating an invisible cloud of danger that lingers in our homes and neighborhoods. These pollutants can trigger asthma attacks and respiratory infections, especially in vulnerable populations like children and the elderly. The fine particles in wood smoke can penetrate deep into the lungs, causing inflammation and exacerbating existing respiratory conditions. In severe cases, they can even lead to heart problems and cancer. Long-term exposure to wood smoke has been linked to an increased risk of cardiovascular diseases and various types of cancer, making it a serious public health concern. It's shocking to think that something as seemingly innocuous as a wood-burning stove could pose such a significant risk to our health. Many people use these stoves for warmth and ambiance, unaware of the hidden dangers lurking in the smoke. Despite growing awareness of the dangers, many people remain unaware of the invisible threat posed by wood smoke. The smoke can seep into neighboring homes, affecting entire communities and contributing to poor air quality. The particles released from wood-burning stoves are often too small to be seen with the naked eye, making it difficult for people to grasp the immediacy of the danger. These microscopic particles can stay suspended in the air for long periods, increasing the likelihood of inhalation. This lack of visibility makes it even more crucial to educate the public about the risks associated with wood burning. By raising awareness and promoting cleaner alternatives, we can help protect our health and the environment from this silent killer. Air pollution is a major public health crisis. In the UK alone, it is linked to thousands of premature deaths each year. Children are particularly vulnerable to the effects of air pollution. Their lungs are still developing, and they breathe at a faster rate than adults. This makes them more susceptible to the harmful effects of pollutants like those released by wood-burning stoves. Despite these alarming statistics, the government has been slow to address the problem of air pollution. While some progress has been made in tackling emissions from vehicles and industry, the issue of domestic wood burning has largely been ignored. This lack of action is unacceptable, and we must demand that our leaders take concrete steps to protect our children's health. Top pediatricians are demanding immediate and decisive action to reduce air pollution, which poses a significant threat to public health, especially for our youngest and most vulnerable citizens. They are calling for a comprehensive ban on the sale of new wood-burning stoves, which are a major source of harmful pollutants. In addition to banning new sales, they also want stricter regulations and enforcement on the use of existing stoves to ensure compliance with air quality standards. This is essential to protect children's health and save lives, as clean air is fundamental to their development and overall well-being. It's time for the government to listen to the experts and prioritize the well-being of our children by implementing these necessary changes. The call for a ban on wood-burning stoves is not about depriving people of their right to choose how they heat their homes, but about finding safer, cleaner alternatives. It's about recognizing the urgent need to protect the most vulnerable members of our society, who suffer the most from poor air quality. Children, with their developing lungs and immune systems, are disproportionately affected by the harmful effects of air pollution, leading to long-term health issues. We must prioritize their health and well-being over the convenience of wood burning, ensuring a healthier future for the next generation. Dr. Mike McKean is a leading pediatrician, renowned for his extensive research and advocacy in child health. He says, "We are facing an air pollution crisis that is escalating at an alarming rate. Wood-burning stoves are a major contributor to this problem, releasing harmful pollutants into the air we breathe. We must act now to protect our children's health, as they are the most vulnerable to these pollutants." Dr. McKean's words serve as a stark reminder of the urgency of the situation, highlighting the immediate need for action. We can no longer afford to ignore the scientific evidence and the pleas of medical professionals who have dedicated their lives to studying this issue. Dr. McKean's call to action is not based on speculation or fear-mongering, but on solid scientific data and real-world observations. It is grounded in years of scientific research and clinical experience, underscoring the gravity of the situation. The evidence is clear. Wood-burning stoves pose a significant risk to human health, particularly to the developing lungs of children, who are more susceptible to respiratory issues. We must heed the warnings of experts like Dr. McKean and take immediate action to mitigate this growing threat for the sake of our children and future generations. Dr. Emily Parker is another concerned pediatrician. She says, "The evidence is clear. Wood burning is harmful to children's health. We need to phase out wood-burning stoves and promote cleaner alternatives." Dr. Parker's statement underscores the need for a multifaceted approach to tackling this issue. Simply banning wood-burning stoves is not enough. We must also invest in research and development of cleaner and more sustainable heating solutions. This includes exploring renewable energy sources, improving energy efficiency in homes, and providing financial assistance to those who cannot afford to transition away from wood burning. One of the most dangerous pollutants from wood-burning stoves is PM2.5. These are tiny particles that can penetrate deep into the lungs. PM2.5 can cause a range of health problems, including asthma, heart disease, and lung cancer. The insidious nature of PM2.5 lies in its ability to travel long distances and linger in the air for extended periods. This means that even those who live far from sources of wood burning can still be exposed to its harmful effects. The problem of PM2.5 is particularly acute in urban areas where wood burning is prevalent. The dense population and built-up environment create a perfect storm for trapping these harmful particles, leading to higher concentrations and increased health risks for residents. Section 8. Remembering Ella and Awab, Victims of Inaction. Tragically, we have seen the devastating consequences of air pollution firsthand. Ella Kissy Deborah and Awab Ishaq were both young children who died from air pollution-related illnesses. Their deaths were preventable. These cases highlight the urgent need for action to address this public health crisis. Ella and Awab's stories serve as stark reminders of the human cost of inaction. Their deaths sparked outrage and calls for stricter air quality regulations. These tragedies should serve as a wake-up call to policymakers and the public alike. We must learn from these heartbreaking losses and prioritize the health and well-being of our children above all else. Section 9. Existing legal frameworks, a step in the right direction. There are existing legal frameworks that could help to address this issue. Ella's Law, named after Ella Kissy Deborah, aims to improve air quality and protect children's health. Awab's Law, named after Awab Ishaq, focuses on improving living conditions and social housing to prevent similar tragedies. These laws are a step in the right direction. However, more needs to be done. While these laws provide a framework for addressing air pollution and improving housing conditions, their effectiveness hinges on robust enforcement and adequate funding. We must hold our elected officials accountable for implementing these laws and ensuring that they have the resources they need to make a real difference in people's lives. Section 10. A roadmap for change banning wood burners and beyond. Banning the sale of new wood-burning stoves is a crucial first step. We also need to monitor air quality more effectively, provide incentives for people to switch to cleaner heating sources, and adopt stricter guidelines from the World Health Organization on air pollution. These measures, combined with a public awareness campaign to educate people about the dangers of wood smoke, can pave the way for a future where everyone can breathe clean air. It's time for a paradigm shift in how we approach energy consumption and prioritize public health. Section 11. Our collective responsibility, a call to action. Air pollution is a problem that affects us all. We all have a role to play in tackling this issue. We can support campaigns to improve air quality, contact our elected officials and demand action, and choose cleaner alternatives to wood-burning stoves. Together, we can create a healthier and safer future for our children. It's time to demand change and hold our leaders accountable for creating a world where everyone can breathe easy. The fight for clean air is a fight for our children's future. Let's work together to create a world where every child can grow up healthy and strong, breathing clean air. The time for